Hi, my name is Latifa Baldwin. I'm going to talk to you about post-operative falls and how to prevent them in ambulatory patients. Did you know that roughly 700,000 to 1 million patient falls occur each year in the U.S. hospital, resulting in about 250,000 injuries and up to 11,000 deaths? Fall rates in the U.S. hospitals range from 3.3 to 11.5 falls per 1,000 days. 23 to 42% are injurious falls. 2 to 9% results in serious injuries or death. Fallers typically stay in the hospital 6.3 days longer than non-fallers. $34,294 is the average hospitalization cost for a fall injury. Liability costs can be significant to injurious life, and also there is no reimbursement for inpatient falls. I am currently employed with Broward Health System in Coral Springs. I work on an acute post-surgical unit where the majority of our patients have had gastrointestinal surgery. The goal of my unit is to make sure our patients are stable post-operatively so they could be safely discharged to either home or to a nursing facility or a rehab facility for continued care. These patients are put under general anesthesia for these surgeries, and when they arrive to our floor, they are typically lethargic but easily arousable. Due to the use of anesthesia, patients that are typically independent are now risk factors. Unfortunately, for my unit, we have had 6 falls for the year of 2023, compared to only 3 falls in the year of 2022. Out of the 6 falls on the unit, more than half of them involved a patient that was deemed independent by their primary nurse. So, what causes a patient that is normally independent to be at risk for falls post-surgically? As previously stated, general anesthesia plays a major factor in the risk for falls after surgery. General anesthesia is used to put the patient to sleep so they can be comfortable and feel no pain during surgery. Patients are typically drowsy after anesthesia until it has fully left their system. These patients are at risk for falls until the primary nurse deems them safe to ambulate on their own. Another risk factor is medical comorbidities. It's very common for a post-surgical patient to have underlying diseases that are not addressed during surgery. The most common ones are diabetes and hypertension, and the combination of the two, which will require the patient to take medications to help maintain the diseases. Not answering the call light in a timely manner puts our patients at risk for fall. It's very common for a post-operative patient to have to use the bathroom post-surgery. We will tell them to put the call light on to ask for help, and we may not be able to answer it in a timely manner, which causes the patient to try to get up on their own because they did not want to risk avoiding in the bed. The improper use of bed and chair alarms put the patient at risk for falls. The purpose of these bed and chair alarms is to notify staff when the patient has left the bed or left the chair. When they are not properly turned on, it allows the patient to get up and move without notification of staff. So now that we've discussed some common factors that put post-operative patients at risk, what are some preventative measures that need to be implemented to reduce the chances of falls? The first thing that should come to mind is this patient is an automatic fall risk because they are a post-surgical patient. The first thing you do when you receive your post-surgical patient is to assess their level of consciousness. As I stated before, they may be lethargic due to the general anesthesia that was used during surgery, but they should also be easily aroused and respond to the sound of your voice. It's very common for patients to experience low blood pressure and pulse and complain of dizziness and lightheadedness upon standing once they arrive to the floor post-surgically. The protocol for the floor is to monitor vitals every 30 minutes for the first 2 hours and then every hour for the next 2 hours. And they're also instructed to not get out the bed without the help of staff. Every nurse must review the current list of medications with the patient at bedside for confirmation. The nurse must educate the patient on the potential side effects that may occur when pain medications is mixed with the current medications the patient is taking. The nurse must also educate the patient to notify staff if there's any signs and symptoms that have occurred with the patient. Staff must conduct frequent rounding and frequent observation on post-surgical patients. Staff must also address any and all needs while in the room to prevent the patient from pressing the call light once staff leaves the room. Before any staff leaves the room, please ensure that all safety measures are in place, such as bed alarm is turned on. If patient is sitting in a chair, please ensure chair alarm is turned on and activated. Ensure call light is within reach of the patient, and remember to answer all call lights, bed alarms, and chair alarms in a timely manner. It's very important for a staff member to ambulate with the patient for the first time post-surgically. The patient may still feel the effects of the general anesthesia and must be assessed by staff before the patient is able to ambulate on their own. The primary nurse must also remember to reevaluate patients that have deemed self-ambulatory and stable. A change in status, starting a new medication, or even stopping a medication can put a stable ambulatory patient at risk for falls. The goal for 3 South Tower is to have 0 falls for the remaining of the year. In order for the unit to reach that goal, staff must complete thorough assessments of our patients and implement fall risk precautions if our patients are at risk for falls. Staff must continue to reassess our patients for risk for falls because new risks may come into play. Staff must communicate among each other and help each and every patient as if it's their own. Answer every call light, answer every bed alarm, answer every chair alarm in a timely manner. If we work together as a team, 3 South Tower is able to achieve our goals of 0 falls for the remainder of the year. My name is Latifah Baldwin. Thank you for listening.